Often, the labels psychopath and sociopath are used simultaneously. Many people know that the two terms mean different things, but do not know how a psychopath is different from a sociopath. A common assumption is that psychopaths are more dangerous than sociopaths, but as we will reveal today, that is not necessarily true. This video will explain the difference between psychopaths and sociopaths and will give you some interesting facts about both conditions. By the end of this video, you will have extensive knowledge of both psychopaths and sociopaths, and you will easily be able to correct your friends when they mistake one for the other. Make sure you stay till the end because we will share some interesting facts on psychopaths and sociopaths. Number 1. Psychopathy is a personality disorder, while sociopathy is not. Psychopathy is characterized by a lack of empathy and a sense of entitlement and impulsivity. Even though the exact term is not the DSM-5, which is the Diagnostic Manual of Mental Disorders, many clinicians use the manual to recognize psychopathy. The personality disorder called antisocial personality disorder, which is in the DSM, is very similar to psychopathy and can be used as a type of screening to diagnose psychopathy. A psychologist named Robert Hare created a diagnostic tool specifically for psychopaths called the Psychopathy Checklist Revised. The checklist measures for 2 factors related to psychopathy: interpersonal and emotional factors, and chronic antisocial behavior. A few examples of what the checklist measures are levels of impulsivity and lying. However, unlike psychopathy, sociopathy is not a diagnosable condition. It is impossible for a criminal to be diagnosed as a sociopath since it is not a recognized personality disorder. There is also no checklist to measure sociopathy. The term appeared near the beginning of the 20th century, when some psychologists thought that external social factors had a major role in the development of psychopaths. Even though sociopathy is not a disorder, the term is still used today. Number 2. Psychopathy is primarily associated with biological factors, while sociopathy is mostly attributed to social factors. Many psychologists believe that psychopaths are born with certain biological and genetic factors that influence their development. These factors cannot be prevented. On the other hand, sociopathy is mostly attributed to social factors. This means that sociopaths are not born with certain biological and genetic factors. Sociopaths develop the way that they do because of their early childhood experiences. For example, a child may have had a healthy and normal brain, but if they are abused as a child or bullied, they may risk growing up to be a sociopath or have sociopathic traits. It all depends on the environment. Number 3. Psychopaths have notably different brain structures. As mentioned in the last point, psychopaths have certain biological factors that are different compared to the average person. One of these factors is their brain structure. Studies have shown that psychopaths have reduced connections between the amygdala and the prefrontal cortex. The prefrontal cortex is responsible for emotions such as empathy and guilt. The amygdala is responsible for the feelings of fear and anxiety. This lack of connection between the 2 brain structures largely explains why psychopaths do not experience fear or empathy. As you have probably guessed now, sociopaths do not have different brain structures than ordinary people. Unlike psychopaths, the connection between the 2 brain structures are still intact and have more connections, which will bring us to the next point. Number 4. Sociopaths still have a sense of morality, while psychopaths don't. Since the brain structure of a sociopath is relatively similar to ours, they can still experience emotions. Sociopaths have a conscience, unlike psychopaths. The thing is, though, even though sociopaths do know the difference between right and wrong, they do not necessarily care. Often, sociopaths do not listen to the voice that tells them what they are doing is wrong. Psychopaths tend to be charismatic and may seem trustworthy. They are also able to hold long-term jobs and are often very skilled at what they do. Psychopaths are also good at mimicking healthy relationships and emotions. On the other hand, sociopaths have trouble mimicking healthy emotions. They do not often hold long-term jobs. They can also seem to be antisocial. Sociopaths can be easier to spot since they do not try to appear normal and open to friendship. Number 5. Psychopaths tend to plan their criminal activities in a way that reduces harm to themselves. They will often also have backup plans in case things go wrong. They can think carefully about how they commit criminal acts and will often cover up all of the details. Unlike psychopaths, sociopaths are very impulsive and erratic when they commit criminal acts. They do not plan carefully, and the most frequent act they commit are called crimes of passion. They let their strong and dangerous emotions take control. For this reason, sociopaths are more easily caught than psychopaths, since they do not care or think about the consequences of their actions. Number 6. Psychopathy is not treatable. Up to this point, there is no known cure for psychopathy. This is largely due to difference in brain structures. You cannot repair physical brain structures with talk therapy. However, studies have shown that forms of positive reinforcement can lower the number of criminal acts that a psychopathic youth commits. Sociopathy, however, is more treatable since the condition can usually be traced back to traumatic childhood experiences. Sociopaths still have intact moral values and a conscience. Therapy will be able to tap into that more so than psychopaths who have no sense of morality. Interesting facts. Now that we know the difference between a psychopath and a sociopath, let's look at some interesting facts. Most well-known serial killers are psychopaths because of their ability to disassociate themselves from the violent acts they commit. Famous serial killers who were psychopaths include Ted Bundy, Charles Manson, and the Zodiac Killer. Even though a person can be born with a biological predisposition to psychopathy, they can still grow up to be a functional and normal person. The environment they grow up in can actually trigger those psychopathic traits to appear. For example, a child with the brain structure of a psychopath can avoid becoming dangerous if they experience a loving and supportive childhood. Despite common assumptions, many sociopaths and psychopaths are living among us. Each can function regularly, depending on the level of their condition. Only a very small number of psychopaths and sociopaths actually commit violent acts. Despite the many differences listed, psychopaths and sociopaths do have a few things in common. Both can be deceitful, manipulative, and often do not care about the well-being of others. Both psychopaths and sociopaths have the potential to be dangerous, but that is not a definite trait of either. Overall, both psychopaths and sociopaths can be dangerous but still live normal lives. While psychopaths are more charismatic and detail-orientated in their planning, sociopaths tend to be antisocial and commit crimes of passion. We hope you learned a lot today. Make sure to leave a thumbs up if you enjoyed the video and subscribe to the channel for more interesting content.